okay?
Yes, that's absolutely great.
Wonderful, lovely. So yeah, as Claire mentioned, I'm an antimicrobial stewardship pharmacist working for Powys at the moment, and but I'm here on behalf of the Welsh Antimicrobial Pharmacist Primary Care Group. So what that means is a group of pharmacists across Wales looking to help with antimicrobial stewardship, so the appropriate use of antibiotics, particularly in primary care. So that's your GP settings, community pharmacy, care homes, sort of across the kind of primary and community care setting. So as opposed to the hospital setting, there are groups that look on hospital, but this is particularly for those kind of community settings. So just by way of introduction, and apologies if you've heard these messages before, as Claire mentioned, I'm sure antimicrobial resistance has come up here in this group in the past, but it's just to reiterate, really, we're looking at this because it is a significant and growing problem, the fact that the bacteria are becoming resistant to the antibiotics that we've got available, which really means that the antibiotics that we use are becoming less effective, which is an issue because we really need them to treat infection. So the overuse of antibiotics is in particular contributing to antimicrobial resistance. And as such, the government is tasked with making sure that by setting targets, that we reduce our antibiotic usage, particularly in primary care, by 10%, because primary care is where most of the antibiotics are given, actually, in compared to hospital. So this is what we're looking at. So part of this is around informing patients and the public about antimicrobial resistance and what this means to them. So making the message, as close to home as possible, really. And that's really an important strategy to help reduce overuse and misuse of antibiotics. So we've produced some posters that are intended to be displayed in GP settings or community pharmacies, either on the screen to try and help with reducing the paper and our sustainability, but obviously not everybody's got this TV screen, so we've accounted for both. And this morning I also want to present a leaflet that we've developed regarding penicillin allergy. So a slightly different topic, but very much related to the to reducing the inappropriate use of antibiotics. And I'll explain a little bit more about that as we go. So I think what I'll do is I'll show you the posters. Some of you may have seen these already because they were circulated prior to the meeting, but if you haven't, not a problem. I'll go through them, and then at the end I've got a kind of set of questions that covers it all, really, rather than going through each one individually, because they're all quite similar in their messaging. So I thought it would be more time effective, really, to have the discussion after going through the posters, if that's okay with everybody. Lovely. So I'll start with the first poster, which is around antibiotic use. And I should say, this has come from feedback from both people in the community, but also our GP colleagues who felt it was really important to have some sort of messaging to say, look, antibiotics don't work for every infection, particularly viral infections, so your ear, nose, throat, and many chest infections. Actually, antibiotics aren't going to work because they're mostly caused by viruses, which antibiotics don't kill. So they're intended for display in these kind of waiting areas, really. So your GP practice waiting room, or community pharmacy. They could go anywhere, really. But the wording of it is kind of the practice or the organisation's commitment to appropriate use. So we're focusing the message that we're trying to improve the right use of antibiotics rather than giving them willy-nilly. So that's the idea. So it explains why antibiotics might not be given and the risks associated with them. We try to keep the wording down, put some pictures in there, make it as a little bit colourful, and then also contain those key public health messages. So really, to summarise this leaflet, it's to say antibiotics don't work for every infection, a little bit about resistance, and really the prescriber or the pharmacist isn't going to give antibiotics when they're more likely to do more harm than good, which sounds quite obvious, but then I think the understanding around, coughs, ear, nose, throat infections being viral predominantly will hopefully help reset maybe the expectation that an antibiotic is what you need to knock this infection on the head, when in fact it's more likely to cause side effects than actually beneficial outcomes for people. So that's the first one. As I said, if you have, I'll leave it up there for just a few more seconds, just to give you a chance to read it if you've not seen it prior to the meeting. And then I'll move on. I'm happy to go back and forth during the discussion. We have put these in Cymraeg as well, so for our Welsh speakers, these are available in both and will be displayed side by side in both settings. Lovely. So this is the same wording. It might just make it a little bit easier to see on the screen, but this is the sort of format for the TV screens in community pharmacies or GP settings. So it's just a little bit of a different layout, but it has the same messaging, but a little bit of different graphics to be able to fit in this landscape format, really. So I won't dwell on that because it's exactly the same as the other one, save a couple of graphics, really. Now, so moving on to the information leaflet, and as I said, this is designed to be either a printed out leaflet or to be given via the GP system. So when this was developed with our sort of GP colleagues, they were quite keen that it would be in a format where it could be sent via the mobile phone. So, for example, if somebody goes into a consultation with let's say a throat infection, so a sore throat, but then when they've been assessed by the prescriber, be it a nurse or a pharmacist or a doctor, they've been assessed as actually antibiotics aren't going to help in this instance. This is designed to explain a little bit more about that, and then it will be able to be sent via the GP system to the patient's mobile phone. If they're not a mobile phone user or don't have a phone that will allow them to see that kind of PDF version, then it can be printed out directly. But what this information leaflet does is really just explain a little bit more about the risks and the benefits of antibiotics and why we're worried about antimicrobial resistance. What I should say is, if you've ever come across the target information leaflet, so these are produced by the Royal College of General Practitioners. These are really helpful leaflets that sort of explain a little bit about what to expect from your particular infection in terms of how long it might last, some self-care advice, and then when to consult your doctor again if, for example, you're feeling really unwell. These are designed not to replace those leaflets, but to supplement them. And again, this is more from that kind of feedback from our primary care colleagues. That's something a little bit extra that explains about resistance and why doctors aren't handing out antibiotics perhaps as readily as they were a few years back. That's the kind of crux of this. And again, we've got that in Welsh as well. For completion, we've done one for when antibiotics are given. So again, it's just another information source that helps to explain how to take antibiotics, what to do if you miss a dose, if you accidentally take an extra one, about things about finishing the course. So we all know, we've all seen these information leaflets that kind of go in the packet of tablets, and they can scare you, can't they? And they're very wordy and they're very long, and I don't think I've ever read one front to back when I've had some medicines given to me. So this is hopefully a little bit simplified, quicker to read, and gives you the kind of information that you most need when you've been given antibiotics. Again, they're produced in Welsh and English, and the idea is that we'll do a once for Wales approach. So if everybody's happy with their content, we can make them available, and then it just saves each health board or each GP surgery, reproducing their own kind of version of these. So I should say this is also recommended in the NICE guidance around antimicrobial resistance, is that we are giving people information about how to take their antibiotics, further to the kind of the package information leaflets that the manufacturer give you. That's very scary and very wordy quite often. So, and then I'll just round off with the last poster that we've produced. And this is, as I said, slightly different theme, but very much related to the appropriate use of antibiotics. So there is a piece of work going through at the moment nationally that's looking to help GPs or pharmacists or whoever in practice, healthcare professionals, to safely review people that have got a penicillin allergy label on their medical record to check if that's still current and if that's really an allergy. Because what we know is that 9 in 10 people, or more than 9 in 10 people who've got a penicillin allergy label, aren't actually allergic to penicillin and can very much safely take penicillins. The reason being that either it's been put on the record and it was never an allergy in the first place, it might have been a tummy upset, or sort of a nausea and vomiting, or sometimes thrush, or something, another kind of side effect of an antibiotic that is really unpleasant but is actually quite expected from using antibiotics. Or that they did have a kind of an allergic type reaction, but in childhood, quite often associated with an infection itself. So if you have a sore throat or tonsillitis, quite a lot of the time you will end up getting a viral rash. But because it coincides with being given antibiotics, it's labelled as a penicillin allergy. So what this guide does is to help structure that review. So this poster is aimed to kind of support that, and again be displayed in GP waiting areas, just to kind of prompt the thought of, oh, do I have a penicillin allergy? Have I ever been told that I'm allergic to penicillin? And perhaps I can ask my doctor about that at the moment because I'm unwell. I think I might need an antibiotic. And it just prompts that conversation, because penicillins are in fact for most infections the safest, most tolerated antibiotic that you can get. And if you've got this allergy label, it's been shown that you will then get a potentially slightly less effective antibiotic with more side effects. So we're trying to really encourage the use of appropriate penicillins where we can. So that's the idea. So it just gives a little bit of information about that, really, just to prompt thought, and if that conversation then could happen during the consultation. We are in Powys, we are doing this work across primary care settings, and we're finding a lot of people have been labelled penicillin allergic and actually have been given penicillin quite successfully after, but still have the label on their record. So we're doing some work to try and reduce that. So that's the idea of that poster there. Again, just to give information and prompt that discussion. So after all of that, I know some of you may have seen those leaflets and posters prior to the meeting, but I was quite keen really to get your views on them, to see if there's anything that you particularly like about the content, or if there's any messages that stand out, anything that you think we could make clearer, or anything that you think we could make more engaging. So I'll leave the questions up there, and I think perhaps what might be best is if anyone's got anything they want to add or discuss or ask about, then kind of leave it open. Is that all right, Claire, to do it that way?
That's absolutely fine, Amy. Thank you